one particular patient that we have right up here, DB, had deals with ulcerative colitis and has had periodic flares that has landed him in the hospital at different points in time, and just flat out refused restrictive diet. He was very inconsistent and sort of meh about taking herbs. So it's like they would get prescribed and sometimes he'd take them, sometimes he wouldn't. And so really, but he was totally committed to getting acupuncture every week. And so that's where it's like, okay, I have to work with a patient with where they're at. And so if he's not willing to change his diet and he's not willing to take his herbs, then I still have other tools to use. And so that would be acupuncture and acupressure. And so, when he would experience a flare, even just from acupuncture alone, we were really able to minimize that pain that he was in and to really increase the recovery as fast as possible. And while I kept trying to encourage him, to do herbs, I think as he started feeling better, it was something that he would consider doing a little bit more. But, once we really were able to hone in on what the trigger foods were, it was essentially his choice. He could have the choice. Okay, well, I know that dairy and beans and nuts are really not great for me. And he's, was able to abstain from them for a period of time. So then when he had them again, one, it was a conscious choice to have them versus just sort of living on without that kind of mindfulness. And when he did have them, he was able to tolerate them a little bit better because it wasn't like having milk in your coffee every day. And the dosage of those inflammatory foods were less. And so he was able to, bump up that threshold. So that way he was able to have it once in a while without, paying for it with a flare. And so, ulcerative colitis, you do have, like I said, there's more wiggle room in terms of your diet as to how that can be helpful. But for him, acupuncture was really the key in terms of reducing that pain and reducing the intensity of those flares. Now, another patient, PS, she is a person with celiac disease who had refractive celiac. So this person was so exquisite about her diet and so conscious of eating the autoimmune diet, that anti-inflammatory protocol, and really good about taking herbs, and just really tried her best to live, to be as healthy as possible, and yet still had to take 2-hour naps every day. Had damage, was having elevated antibody levels, had despite being diagnosed for years, her blood work never stabilized and she still never felt good. And so for her, working her with herbs, because she was so great about taking them, made a huge difference. Suddenly, she was able to not have to take naps every day, to have the energy to when she would first wake up in the morning, there was a sensation of dread because of all the things that she had to do. And so for her to be able to wake up in the morning and be all right, cool, what's on the agenda, and feel like she had the reserves to be able to get through it is a tremendous success. There was also pretty significant joint pain, even though there was no inflammatory foods in her diet. And so, to be able to provide acupuncture and teach her acupressure at home to help ameliorate and reduce those intensity really, really expanded the quality of her life. And so, and now, again, I talked about the awareness of those perfect storm moments of if you have a bout of insomnia, it's before your period, and there's a tremendous amount of stress, not necessarily having gluten for someone with celiac disease, but for people who have other conditions, those can be a big flare. Or for someone with celiac disease who has refractive celiac disease, and there's those components, we can work from that and, maybe modify the formula a little bit, or to do different acupuncture points to really help kind of overcome that hump, so that even though it's a really difficult period, it doesn't send you in a downward spiral.